Hi, my name's April, and this lesson is going to be going over archery and Parkinson's disease. So, to begin, the objectives for this lesson are to discuss a brief overview of Parkinson's disease, archery, and then adapted archery, and then I'll be going over my SOAP plan from an occupational therapist standpoint. So, what is Parkinson's disease? Parkinson's disease is a progressive nervous system disorder that affects movement. Symptoms start gradually, sometimes starting with a barely noticeable tremor in one hand. Tremors are common, but the disorder also commonly causes stiffness or slowing of movement. In the early stages of Parkinson's disease, your face may show little or no expression. Your arms may not swing when you walk. Your speech may become soft or slurred. Parkinson's disease symptoms worsen as your condition progresses over time. Although Parkinson's disease can't be cured, medications might significantly improve your symptoms. Occasionally, your doctor may suggest surgery to regulate certain regions of your brain and improve the symptoms. Some of the symptoms include tremor, which usually begins in a limb, often a hand or fingers. Bradykinesia, which is the slow movement. Rigid muscles or stiff muscles, which can be painful and limited range of motion. Impaired posture and balance, which may become stooped or have balance problems. Loss of automatic movements, and so they may have a decreased ability to perform unconscious movements. There could be speech changes, so they may speak softly, quietly, slur, or hesitate before talking, and they may be more monotone. And they could also have writing changes, and so their handwriting may become hard to write, or it may become hard to write, and the writing may appear small. So the causes are unknown, but genes and environmental triggers may play a role. Some of the risk factors could include age, so it's typically people over the age of 60, heredity, sex, so it's typically more in males, and then exposure to toxins is also a risk factor. So now we're going to be talking about archery. Archery is a sport in which you use a bow to shoot arrows. Historically, archery has been used for hunting and combat. In modern times, it is mainly a competitive sport and recreational activities. There are many types of bows used for archery. Some include longbow, crossbow, compound, recurve, takedown, and composite bows. Target archery competitions may be held indoors or outdoors. The indoor distances are 18 meters, and outdoor distances range between 25 meters to 90 meters. The competition is divided into ends of 3 or 6 arrows. And so, how do you actually shoot a bow? The first step is your stance. You want to stand up right with your feet shoulder width apart and feet at a 90 degrees to the target. The second step is the grip. So you have to keep a relaxed grip on the bow handle. The third step is to place the arrow on the bow. Turn the bow so that it is horizontal and the arrow rest is facing upward. Place the arrow on the shelf of the arrow nest, or of the arrow rest. Push the nock of the arrow onto the string between the two brass nocking points, ensuring that the cock fletch is pointing upward, and then bring the bow back to vertical. The fourth step is finger position. Position the fingers of the string with the index finger above the arrow and 2 fingers below. The string should sit in the last crease of your fingers. The fifth step is the draw. Do not grip the arrow with your fingers. Pull back the string using your back muscles, not your biceps or arm. Pull back on the strings with the index finger of the pulling hand is under the chin, and the string touches your nose and lips. The sixth step is aiming. Using your dominant eye, look down the arrow and align it with the target. The seventh step is release. Relax your grip on the string and allow your fingers to slip backward. After shooting, maintain your body position. So now we're going to be talking about adapted archery. There are many ways to adapt archery. A simple adaptation is having physical assistance. Someone could assist with knocking the arrow and drawing and releasing the bowstring. There are also bow stands so that the archer can focus on just pulling back the string. And there's also finger tabs and gloves that could help with someone that has limited grip. There are also mouth tabs available for someone who has the use of the arm, and then the tab attaches permanently to the bowstring and is held between the archer's teeth while drawing and holding and releasing. There are also mechanical release aids, and using a trigger mechanism can assist with the release of the bow. So now I'll be going over my SOAP plan. So for the subjective section, the patient is a 55-year-old man named John Doe who had been diagnosed with Parkinson's disease. For the objective, so from the exam, the patient's symptoms include stiff muscles, hand tremors, slow shuffling, walking gait, difficulty standing, difficulty walking, and difficulty speaking. So for the assessment section, John Doe is a 55-year-old man with Parkinson's disease. Due to stiff muscles, he has difficulty walking and has a slow shuffling walking gait. He typically uses a walker and occasionally needs a wheelchair. So going over the plan, we will begin in the typical clinical setting to focus on the gross motor movements in the upper body. There will be minimal physical assistance with all these exercises except for when they're needed. So we will begin with the standing stretches. The first stretch is the chest stretch. Stand facing a corner, placing the forearms and hands on each wall. Lean forward into the corner, keep the head up, and feet flat on the floor. The second stretch is the back stretch. Stand with the feet hip-width apart, place palms on the low back, and gently lean trunk and back or neck back. The third stretch is the shoulder stretch. Stand tall with feet hip-width apart, clasp hands behind the back, gently lift arms up and away from the back, keeping the head up. Next we'll be doing the lying stretches. The first one of the lying stretches is the shoulder stretch. So lie flat on your back, slowly lift arms straight up and allow them to fall back overhead. The second one would be the rotation stretch. Lie on your back with the knees bent and feet flat. Arms should be outstretched at your side. Rotate both knees to one side, keeping arms and upper torso flat. Turn the head in the opposite direction and repeat rotating the knees in the opposite direction. After completing these, we will do seated stretches. So the first one of the seated stretch is the overhead stretch. Sit tall in a chair and lace fingers together. Turn palms facing out and slowly lift arms overhead. Gently allow the neck to fall back. Look up at the hands. And then the last stretch that we'll be doing is the cross-body reach. Sit and use one arm to lift the other arm at the elbow and bring it up and across the body. With gentle pressure to stretch the shoulder, hold for 20 seconds and repeat 10 to 20 times. Switch arms and repeat. Then again, there will be physical assistance as needed. After warming up, we will go into the indoor shooting arena. There will be a target bow and arrow set up. Due to the stiff muscles, the patient will use a lighter bow and have physical assistance as needed. Assuming there will be little physical strength and hand grip, we will be using a mechanical releasing bow. Before shooting the arrows, we will discuss the safety precautions that need to be taken, such as only aiming at the target, not dry firing, and do not shoot if someone is in the shooting arena or area. To begin, we will be roughly 10 meters away from the target to become comfortable with shooting the bow and arrow. An assistant will be knocking the arrow for the patient, and then the patient will be pulling back the string with physical assistance if needed. And then And then there will be the mechanical relays. So this will help be more accurate since the tremors may interfere, and the patient will shoot 10 arrows from this distance, and then the assistant will then retrieve the arrows after the patient is done firing. The patient will then move to 15 meters away from the target and do the exact same thing. The assistant will nock the arrow and then retrieve the arrows after he has shot all 10. After becoming comfortable from the 15-meter mark, we will move to the 20-meter mark. The patient will shoot from this distance 10 times, and the assistant will retrieve the arrows, and then the patient will have the opportunity to shoot 10 more times from this distance. So after shooting the last round of the arrows, the assistant will retrieve the last one, and then we will go back to meet back in the clinical area to discuss the day. The occupational therapist will ask the patient's opinion of the lesson and see if he has any suggestions to possibly improve it for the next time. And that is the conclusion of my video.